I just love to travel, especially to the beautiful countries along the Mediterranean Sea. Did you know that people living in some of these countries that border the Mediterranean Sea tend to be healthier and live longer? Research has shown that eating habits in some of these regions have many health perks, including lowering the risk of heart disease. Hi, I'm Dr. Ghotra. I'm a cardiologist specializing in heart failure at the Florence Wormald Heart and Vascular Institute at St. Elizabeth. In this segment, we'll explore the positive impact of the Mediterranean diet and its heart health benefits. Mediterranean diet is traditional foods of people living near Mediterranean Sea. Mediterranean diet is a way of life, things that you should be incorporating in diet day to day. It shouldn't be things that you should restrict, but things that you should focus on eating. Mediterranean diet is considered heart-friendly because of extensive studies that have done over time that have shown a reduction in heart disease, lower blood pressure, lower cholesterol, lower risk of diabetes, weight loss, including weight management, and significant reduction in cancers, anxiety, and even depression. Foods that you should be eating with Mediterranean diet consist of what things that you see here on the table, like fresh fruits, fresh vegetables, nuts, low-fat dairy, things like yogurt, olive oils, and fish like salmon. The biggest food in Mediterranean diet that should be avoided is foods that are processed or packaged or refined, things like red meat, deli meats, and foods that are high in added sugars. Yes, you can always do the diet even if you don't like fish. You can substitute fish for other leaner proteins such as chicken, and there's plant-based proteins, things that like hummus could be substituted. Once you start Mediterranean diet, it will take some time before you see significant health benefits, even months to years, but as long as you stay consistent, you'll see those benefits lifelong. No, generally you don't need a doctor's recommendation to start this diet. But if you're on high-risk medicines, for instance, things like Coumadin or also known as warfarin, because of the type of diet, it should be discussed with your doctor before you start this diet. So the big things before you get started on diet is, one, have a clear plan. Make sure the whole family is involved and everyone's on the same page. You're not cooking multiple meals for multiple people, which is going to be difficult to stick with. Number two, figure out a budget. Certainly vegetables and fruits nowadays can cost a lot, and you want to make sure that before you go into a grocery store, you're aware of what you are buying and what your budget is. And lastly, be consistent and don't be rigid. You can have days where you don't necessarily follow the diet fully, but as long as you're consistent, you will get the results. Thanks for taking time to learn about the Mediterranean diet. Hopefully, now you can start introducing some of these healthy foods into your everyday life. Incorporate new things gradually. Every little adjustment today makes a big difference tomorrow. Look for more segments from the St. Elizabeth Take Time for Your Heart program to find additional heart-healthy eating tips to help lower your risk for heart disease.